Hi, I'm Dr. Greg Fontana, and I'm the director of the Cardiovascular Institute at Los Robles Regional Medical Center here in Thousand Oaks. I'm going to speak today a little bit about COVID and its effects on the heart. We hear a lot about COVID and how people can't breathe and they get terrible pneumonias, and it's really what brings most people to the hospital with COVID. But what we've seen over the last couple of years is a significant number of people who contract COVID also have a new cardiac diagnosis. It affects the heart too. It appears that it affects the heart through inflammation. We don't understand why, but the virus somehow in some people create inflammation in the muscle of the heart. The most common diagnosis we've seen with the experience of patients in the hospital has been a new diagnosis of atrial fibrillation, which is an erratic rhythm in the top part of the heart. And in some people, they may not notice too much. Others feel it very strongly, like a fluttering in the chest, or maybe it causes additional shortness of breath. We're not sure if this is going to be a long-term problem for patients after their COVID resolves, or if it's something that goes away when the COVID symptoms resolve completely, but we're looking at it. But there's some other scary things that we're seeing that are more dramatic with COVID, and that's something called myocarditis, where the inflammation of the heart is very severe. It sometimes causes chest pain. It can cause a weakening of the heart muscle and cause additional shortness of breath. So far, we see that the myocarditis does resolve in most patients, but in some patients, it takes a long time and their heart function may never return all the way to normal. We do have therapies to help patients with myocarditis that work in concert with treatment of COVID, but we're still trying to understand exactly what the effects are going to be on the heart long term. We have a very large clinical trial going on right now in the healthcare system that owns Los Robles Regional Medical Center, studying 130,000 patients to see if we can wrap our heads around what's going on and determine if there is long-term needs in terms of follow-up and or therapies. The data is starting to emerge that the incidence of heart attack is even tripled or even more in patients who have COVID versus patients who don't have COVID. Also seeing a higher incidence of stroke. Again, we don't understand this completely, but it does seem to be a factor that's related to COVID that causes increasing blood clots that form inside the body. So who's at risk? Again, we don't know, but we're studying this very, very carefully and taking it very seriously. COVID is going to be with us for many years to come. I expect I'll hear about it the rest of my life, but it should be manageable. It should be something that we begin to understand more and more as we get further down the path of the experience. As of today, in February of 2022, it appears that Omicron is going away. Symptoms are less strong than they've been in the past with other variants, and the cardiac manifestations seem to be more minor. But we're still managing a lot of patients with COVID-related cardiac diagnoses, and I wish I could tell you more about where we're going to be in 5 years with this. But right now, all I can say is we're actively studying it, we're aware of it, and we're taking it very seriously. If you feel like you have any symptoms of chest pain, or you have a fluttering in the chest, or new symptoms of shortness of breath, it's now something we consider as a COVID-related diagnosis. So if you have these symptoms, please proceed to see your doctor if you're pretty stable. If you're not feeling well at all, you should proceed to the emergency room for evaluation and get prompt therapy.